Diabetes can affect many parts of our body, including our skin. Some skin changes are seen in the later stages of diabetes, but some changes are early indicators of the condition. In fact, skin problems are sometimes the first sign that a person has diabetes. A few skin lesions are typically seen in diabetes, but some skin changes are general and can occur in anyone. However, people with diabetes tend to develop them more easily. Let's discuss the signs one by one. Have you ever noticed a dark patch or a band of velvety skin on the back of your neck? Not only on the neck, but it can also be seen in the armpit and groin areas. It is commonly seen in obese people. The medical term for this condition is Acanthosis nigricans, and it is a sign of high blood glucose levels. It may be the first sign that someone has diabetes. If you notice this type of skin change, consult your doctor. Early detection of diabetes can prevent many future complications. The next important feature is skin tags. Many people have a few skin tags or skin growths, which are normal and harmless. However, as you can see in this image, numerous skin tags with blackish discoloration of the skin can be a sign of high blood glucose levels. These growths are most common on the eyelids, neck, armpit, and groin region. You may also see yellow, reddish, or brown patches on your skin. This skin condition often begins as small, raised solid bumps that look like pimples. As it progresses, these bumps turn into patches of swollen and hard skin. The patches can be yellow, reddish, or brown. You may also notice that the surrounding skin has a shiny, porcelain-like appearance, and you can see blood vessels. The skin is itchy and painful. This skin disease goes through cycles where it is active, inactive, and then active again. The medical name for this condition is Necrobiosis lipoidica. If you see this type of skin lesion, get tested for diabetes. Another important change is skin hardening and thickening. About 1/3 of people with type 1 diabetes have digital sclerosis, a thick, tight, waxy skin that develops on the back of the hands. The finger joints stiffen and become difficult to move. Sometimes, this skin problem occurs on the toes and forehead as well. Rarely, knees, ankles, or elbows may stiffen. Control of blood glucose levels and physical therapy may be helpful in this situation. You can use moisturizer to soften the skin. This skin condition causes spots that create a barely noticeable depression in the skin. It's common in people who have diabetes. The medical name is diabetic dermopathy. It usually forms on the shins. In rare cases, you will see it on the arms, thighs, trunk, or other areas of the body. The spots don't cause any symptoms. For these reasons, many people mistake them for age spots. Unlike age spots, these spots and lines usually start to fade after 18 to 24 months. Diabetic dermopathy can also stay on the skin indefinitely. It's rare, but people with diabetes can see blisters suddenly appearing on their skin. You may see a large blister, a group of blisters, or both. The blisters tend to form on the hands, feet, legs, or forearms and look like the blisters that appear after a serious burn. Unlike the blisters that develop after a burn, these blisters are not painful. Eruptive xanthomatosis is commonly seen in uncontrolled diabetes. When these bumps appear, they often look like pimples. Unlike pimples, they soon develop a yellowish color. You will usually find these bumps on the buttocks, thighs, crooks of the elbow, or the backs of the knees. They can form anywhere, though. No matter where they form, they are usually tender and itchy. These yellow bumps disappear promptly when diabetes is well controlled. People who have diabetes tend to get frequent skin infections. These could be bacterial or fungal. Bacterial infections commonly seen in diabetes include staph, which is an infection of the glands of the eyelid, folliculitis, or infection of the hair follicle, carbuncles, or deep infections of the skin and the tissue underneath. Fungal infection is also very common in diabetes. It is most commonly seen in warm, moist folds of the skin, like under the breast, around the nails, between the fingers and toes, corners of the mouth, armpits, and groin region. Common fungal infections include jaw itch, athlete's foot, ringworm, and vaginal infections that cause itching. Having high blood sugar for a long time can lead to poor circulation and nerve damage. You may develop this if you have uncontrolled diabetes for a long time. Poor circulation and nerve damage can make it hard for your body to heal wounds, especially on the feet. These open wounds are called diabetic ulcers. If you have diabetes, you should check your feet every day for sores and open wounds. Localized itching is often caused by diabetes. It can be caused by yeast infections, dry skin, or poor circulation. When poor circulation is the cause of itching, the itchiest area may be the lower parts of the legs. You may be able to treat itching yourself. Limit how often you bathe, particularly when the humidity is low. Use mild soap with moisturizer and apply skin cream after bathing. To conclude, if you notice one or more of the above-mentioned signs, it's important to correlate them with other risk factors like obesity, family history of diabetes, or having a sedentary lifestyle. Just having one sign cannot be directly linked to diabetes, as it can be associated with other diseases as well. However, if you're over 40 and fall into these high-risk groups, it's better to check blood sugar levels on a regular basis. Early detection of diabetes and precautionary measures can prevent many future complications. Alright, that's all for today. Hope you liked this video. Don't forget to like, share, and subscribe to our channel. Thank you.